Have you heard that exercise is medicine? If you moved your body at all today, you delivered a powerful dose of pain-relieving, sleep-inducing, blood sugar-regulating natural drugs to your muscles and to your heart and brain as well. Obviously, there's no substitute for medicine when it's necessary in certain situations, but exercise really can be a miracle cure. In today's episode, I am going to give you some medical reasons as to why exercise is a life-saving activity. Hi, I'm Stephanie Phillips Markstein, and I help health-conscious people optimize their physical and emotional well-being so that they can show up in the world as the best and most confident version of themselves. So what do we mean when we talk about exercise being medicine? Well, first of all, exercise can help you sleep better. Physical activity improves your ability to regulate your mood and lowers anxiety levels, which can cause insomnia. There have been studies of brain activity that show that exercise actually may create a physiological need for deeper sleep. In other words, you wake up refreshed and not feeling groggy. So exercise can also make a difference during the day, helping you hit your to-do list instead of wanting to take a nap at your desk. Research reveals that people who meet physical activity guidelines, which as you know, or you should know because we've talked about this before, is about 150 minutes a week of moderate intensity exercise. So you can do the math on that, but it's about 30 minutes a day. Are 35% less likely to feel sleepy during the day. So if you get your 30 minutes of exercise in every day, you are going to feel less sleepy during the day, but you're gonna have a deeper sleep at night. So what's the best exercise for sleep? Well, it's high intensity cardio. You wanna be able to get out of breath. So think rowing or vigorous biking. If evening exercise works for you, then go for it. But because it's gonna spike your core body temperature and then the subsequent cool down can promote deeper sleep. But make sure that you finish your exercise about 2 hours or a little more before bed. So the next thing that exercise can help with is managing cholesterol. It used to be that we thought that we should lower our total cholesterol, but doctors now look at the two different types, the HDL and the LDL, in different ways. So you probably have heard this. When it comes to HDL, the higher the better. So H stands for higher. It doesn't really, but that helps you remember it. So you want your HDL to be higher. For LDL, the lower is better. And again, L lower. Works out really well, doesn't it? And so as you age, your estrogen levels decline, and so does your HDL cholesterol, the good kind, which leaves your heart vulnerable to damage. So to get your numbers in check, you need to start moving. Research shows that the most potent thing that you can do is exercise. The director of Women's Cardiovascular Prevention, Health and Wellness at Mount Sinai Hospital says, in New York City, says that we don't have a drug that actually does what exercise can do in improving the function of HDL. And so exercise in this case is better than medication. So for every 1% of your HDL, for every 1% that the HDL increases by, your heart disease risk decreases by 3%. So 1% HDL, 3% heart disease risk. So that's some good math. So, but what's the best exercise to help with cholesterol numbers? In that case, the answer is cardio plus strength combination. A regimen involving both cardio and strength training is ideal for increasing the HDL and reducing LDL. My cat's joining us. You will want to try to get a minimum of 30 minutes of, I'm like a broken record, right? 30 minutes of moderate exercise 5 days a week, and at least 2 of those sessions should include strength training, okay? So think, and you never want to do them back to back. So you think like Monday, Wednesday would be your strength, and Tuesday, Thursday, Friday could be your cardio. You can do cardio back to back. You don't want to do strength back to back typically, unless you're doing different types of strength. So if you're doing different body parts, you can do, like, let's say you're doing chest and back one day and you're doing biceps, triceps the next day, and you're doing shoulders and legs the next day. You can do it that way. And that way, if you break it up like that into segments of the body, that's fine. But otherwise, you don't want to do the same. You don't want to do the same muscle groups 2 days in a row. So guess what else exercise helps with? PMS. I know the men can tune out here, but exercise releases, but actually not, because if your wife or girlfriend suffers from PMS, you might want to know this. You can encourage her to get to the gym. Exercise releases feel-good chemicals in the brain called endorphins. And those are a source of natural pain relievers. These help to alleviate many of the common PMS symptoms such as cramps. The best exercise for PMS is cardio or yoga. Obviously, cardio workouts are good at flooding the body with endorphins, but there are many other kinds of exercise that also release them. And if you want a gentler movement, then get out the yoga mat, because there were 15 studies done that concluded that yoga may help to reduce PMS. So the mind-body practice is very powerful and can help to calm the nervous system's stress response, which is helpful because stress is known to worsen cramps. So here's the cat. He's joining us. Just a little piece of him. Yoga can also improve pain tolerance and leave you with a greater sense of well-being. So speaking of well-being, I always like to offer a valuable resource to help you with living your best life. And in today's episode, I am offering a free Keto for Beginners guide. If you have wanted to try the ketogenic lifestyle, or keto for short, but didn't know where to start or what to do, I have done the research for you and made it super easy. So all you have to do is click on the link below and check out my Keto for Beginners. It's a hack that will allow you to get all your questions answered about going keto, so don't forget to grab it today. So back to our exercise, how exercise can help you in your medical situations. Exercise can also help to relieve back pain. Now, I know many of you think that you should probably not work out when you have back pain, but actually the opposite is true. Up to 80% of adults will experience lower back pain of some sort at some point in their lives, and it's one of the most common reasons that people head to the doctor and don't go to work. So the thing is, as I said, while many people think that the best thing that you could do is rest, actually the solution is often the opposite. So pain medications like opioids aren't necessarily the solution either. Our bodies are made to move, and you've heard me say this over and over again, and I will continue to say it. Physical activity helps to lubricate the discs in the spine and improve nerve, muscle, and joint function that play a role in back health. So the stronger your back is and the stronger those core muscles are, the less chance you have of getting ongoing back pain. In many cases, trying to couch potato your way out of back pain actually can end up making it worse. So the specific routine that helps with back pain is a multifaceted one, and that includes cardio, strength, and flexibility. And this is a three-prong approach that gets you feeling better faster. Cardio boosts healing, blood flow to the soft tissues in the back. Strength work that challenges the core builds muscles that support the spine, which can relieve discomfort by as much as 77%. And flexibility trainings, that's your third piece of that, focusing on the spine and hamstrings specifically, improves range of motion, and it helps to temper pain by up to 58%. So you might wish to see a physical therapist who could guide you toward, the specific exercises that can help with your individual needs. But that's not all. Exercise can also help lift depression. And there have been many studies, especially recently, about how exercise has a strong correlation with helping people with depression and anxiety as well. If you are hesitant to go on medication for any reason, you might consider the natural mood-lifting power duo, which is therapy and exercise combined. In 2013, there was a large, well-respected analysis which looked at 39 different studies and examined the role that exercise can play in treatment for depression. And they found that while activity alone isn't necessarily better than antidepressants, for some people it's as effective as psychotherapy, and it's certainly better than no therapy at all. So again, because of endorphins and how they relieve stress, exercise can improve mental health in ways that we don't even really understand. And again, this is burgeoning research that's happening right now. And there's another bright spot in this, and that is that research shows that regular physical activity can actually help to prevent depression. So of course, depression is a serious illness, and if you do have a strong family history of it, then adding an antidepressant, might create the third piece of that puzzle that might be needed. The best exercise for depression is really whatever you can manage. You know, one of the symptoms of depression is the fact that you don't really want to do things. You have a lack of enjoyment in activities. So, you know, getting to the gym can actually be the hardest part of somebody dealing with depression. But one study compared the effects of doing either light, moderate, or vigorous activity for about an hour 3 times a week. And the results showed that even the light activity, like, you know, walking or stretching, improved mental health. So in other words, you don't need to kill it in the gym, you know, to get the benefit of exercise that helps to treat and prevent depression. Shoot for exercising every other day, and, you know, don't wait until you feel ready, because you might need to push yourself to start, but you'll be making a big step toward recovery. And finally, the last medical condition that research shows can be helped by exercise is diabetes. 90% of the 84 million adults in the United States have pre-diabetes, which is like when blood sugar levels are elevated, but they don't know they have it. Left untreated, you know, pre-diabetes can develop into full-blown type 2 diabetes. So you want to, you know, get a grip on it. If you do have pre-diabetes, you want to get a grip on it starting immediately. And starting an exercise program, if you were in this camp, meaning if you have a family history of diabetes, of type 2 diabetes, if you're 45 or older, if you're overweight, if you're sedentary, can bring you back from the brink of a type 2 diagnosis. So during exercise, here's the science part of it. Muscles soak up glucose for energy, which lowers blood sugar. The research shows that in general, exercise helps to prevent diabetes, especially for those who are overweight. So what's the best exercise for pre-diabetes? Power walking. A study found that people who did the equivalent of 11.5 miles of brisk walking weekly, brisk walking weekly, 11.5 miles, which is less than 2 miles a day. It's really not very much. Improved their glucose tolerance by 7%. That result is better than the one experienced by people who did an equal amount of vigorous activity, and almost as good as the one experienced by people who lost weight through diet and exercise. So you don't have to join a gym to reduce your diabetes risk. The most important part is staying consistent. Exercise affects glucose control quickly, so that any effort you put in today is going to matter. I hope this has been helpful and valuable. You know, if so, I would ask that you please like and share my video episode, and encourage your friends to subscribe to my channel, Stephanie Phillips Markstein. In the meantime, don't forget to pick up Keto for Beginners at the link below. And I will see you on the next episode, which is next Thursday, and on Saturdays with Stephanie live on my Facebook page at 10 a.m. every Saturday. Thanks for watching.